Good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to be streaming live spine surgery today on June 10th, 2025. Our first patient of the morning is here for surgery on the cervical spine. He is actually a law enforcement officer who has an injury to his spine in his neck, and he has a herniated disc with degeneration at C4-5. C4-5 disc herniation with degeneration. Basically, I think the gloves are the wrong side, is facing out. The Xray gloves. We're just getting ready to get started. Our patient is intubated under general endotracheal anesthesia. All of our Deuk laser disc repair surgeries done on the cervical spine require patients to be intubated, completely what we call chemically paralyzed with muscle relaxer, and asleep for the surgery so that their muscles in their neck are relaxed so that I can perform the surgery. We're going to be going through the front of the neck. We'll make a 4mm incision. This is endoscopic spine surgery assisted with a laser. We've been performing the same surgery here at Deuk Spine Institute for almost 20 years. Let me just feel the tone. The first thing I'm going to do, it feels good. You guys got them extended?
Yes, we have them on a donut.
Yeah. So what I'm doing is I'm taking my two fingers, I'm pushing the trachea and esophagus away from me, and I'm pushing the carotid sheath and sternocleidomastoid muscle towards me, and I'm creating a small space. Now this technique was taught to me by the Korean neurosurgeon, Dr. Sang-Ho Lee and Dr. Gun Choi. They were the ones who pioneered this particular approach. Shot. I'm going to be using an Xray 2, 3, 4, 5. It looks like I'm right over C5. I need to be a little bit higher. On that X-ray view, you guys can see his neck is a little tight. He's very muscular, a law enforcement officer with a thick neck. He's made it a little harder for me, but I think we'll still get here fine. Shot. All right. I'm a little happy that it's C4-5. Shot. Perfect. AP. We're going to do a quick front-back view. You never rely just on a lateral view. You want a front-back lateral. Two different views. It looks pretty good. I think I'm a little far to the right. Go back. I'm going to come up. Shot. And I'm going to reposition a little closer to me. Shot. And let's get another AP. By the way, this does hurt my fingers quite a bit. Oh, and then Jordan makes it worse by hitting me. But that said, it's necessary. That's perfect. The needle tip is exactly in the center. Jordan, show them exactly where the needle tip is. Now, don't take another picture yet, but show them the endotracheal tube. Yes, that solid line. That's in his trachea going down and ventilating his lungs. Show them the esophageal temperature probe, which is the braided line. That's in the esophagus. So we got one tube in the trachea, one in the esophagus, and you can see how I've pushed them over with my fingers. That is key to doing this surgery. Shot. You must be able to displace the soft tissues with your fingers. All right, and it requires very strong fingers. AP. I do my finger exercises every morning. All right, if you have questions, feel free to type up your question, and I will do my best to answer them for you. Now, this patient does have neck pain, but he also has arm symptoms. And arm symptoms come from irritated nerve roots. He has both. He has discogenic neck pain from the tear in the back of the disc, shot, and he has arm symptoms. Look at that. So the dye is leaking out, the black dye is leaking out to the back of the disc, and it's going around the nerve root. Show us the nerve root wrapping around, right there. That's the nerve root. That is the C5 nerve root on the right side. The tear is on the right side. The dye is leaking out the back of the tear. Give me an AP. And you can actually see the dye wrapping around the nerve root there on the right side, right C5 nerve root. Shot. Beautiful. There is the dye on the right side. You guys see that? Jordan, show them the nerve root. You guys can actually see the nerve root. It's right there. Go down. Sweeping. Yeah, there it is. That's the nerve root. That's what's being irritated by the herniation. That's what we're going to fix today. All right. Shot. Very good. Now, this patient did not have to have the Deuk laser disc repair. He could have gone with a fusion or a disc replacement. But fusions and disc replacements are highly invasive and dangerous and unnecessary. This surgery you're watching right now is the future of spine surgery for herniated discs. The problem is most surgeons don't know how to do it. I had to go overseas and learn the technique from the South Koreans. Dr. Sang-Ho Lee himself taught me. This was 20 years ago, overseas. And I brought the technology back to America, and I was basically the first to start doing it. Now this is called transdiscal. There are a few other variations, but this is the best. Any questions?
At this moment, no current questions.
All right, so I'm making a 4mm incision. Okay, it's tiny, tiny incision. And now I'm going to shot. I'm going to take my needle out and I'm going to leave the guide wire shot. Now the guide wire will guide the dilator. So the needle's out. Remember I put that in first. This is the dilator. This dilator is super skinny. It's going to slide down the guide wire and it's going to basically create a space for the tubular retractor that I use to do the surgery. The whole surgery is done with maybe 1 or 2 drops of blood, and the patient's going to go home today. Shot? He's going to go home an hour after his surgery. No metal, no fusion, no hospital, and to date, no complications. We've never had a complication from this surgery. All right, let's get a quick AP. Any questions?
At this moment, no current questions.
Shot? All right, we're still in the middle. You see the tip of the dilator is pretty much in the middle of the spine. And the guide wire goes off to the right. So I'm going to advance this tip into the disc. You got a little inline. My anesthesiologist will give me a little inline. I am going to take the guide wire out. Let's see. Shot. All right, now I'm going to advance this dilator right through what's called the anterior longitudinal ligament, which runs in the front of the spine. So we went through the ligament. Now we're going through the disc all the way to the back where the herniation is. See where the tip of that dilator is on that picture? You can still see the nerve root, by the way. Look at the nerve root. The C5 nerve root is being outlined by the dye. The dye wraps around the nerve root in the epidural space. Look at the bulge. You guys see the shadow of the bulge right there?
Yes, we do.
That is the bulging disc, bulging backwards. That negative image where you don't see the dark, you see the light. That is the herniation. And then we're going to redirect and angle, and Dr. Berndes is giving me some nice inline traction, so it helps me advance all the way to the back of this disc. I'm inside the annular tear right now as we speak. Hold that. Now, once again, he did not want fusion. He did not want ACDF. He was offered ACDF. He was offered artificial disc. But all those surgeries are invasive and dangerous. And the complication rate for ACDF, for example, is 50%. We've been doing the same surgery now for 20 years almost with 0 complications to date. Now I'm going to advance the tube. You guys see the tube? Show them the tip of the tube as it slides along the dilator to the back of the disc where the herniation is. Now this tube is what I'm going to use to do the whole surgery, just a 4mm tube, tiny. And what makes that possible is the endoscope. I couldn't do this without the endoscope. So you must have the endoscope. Most spine surgeons have no clue how to use a true endoscope. I was laughing in Boston a few weeks ago at the American Association of Neurological Surgeon meeting when there was 2 neurosurgeons who were talking about endoscopic spine surgery and how they've been doing it for 5 years and they thought that they were the pioneers. I've been doing it for 20 years. They're 3rd generation. I'm 2nd generation endoscopic. Shot? All right. That's looking pretty close to what I want. Hold on. Luis, I want you to give me just a gentle up here. A gentle up like that. Gentle. Shot. And I'm going to advance a little bit more. We're almost where we need to be. I think that's good. I'm very happy with that. We're going to take the dilator out. Now we're left with just a tube. You guys see this 4mm tube?
Yes, we do.
We've had a few drops of blood. That's the whole blood for the surgery. And this patient doesn't need to be in a hospital. He's going to go home after the surgery. He found us on the internet. I think he found us on YouTube, or somebody referred him, one of my past patients, and knew that he didn't want invasive surgery. All right, Henry, let's show the audience the 20 different causes, 30 causes of neck pain. And this patient has one. He has a herniated disc at C4-5. But let's show the audience the 30 causes of neck pain while we get started. Wait, before we do that, let's turn the light back on. I want to show the audience the endoscope so you guys get a good idea of what it looks like. Can you guys see this?
Yes, we can.
All right, so the endoscope really starts here, and it's a long metal tube with some lenses. It's got some channels in there that allow me to use the laser, and it's got irrigation, so I have cold, sterile saline going through there, irrigating all the debris out and keeping the laser cool. I've got a light source here, I've got a camera here. So that's what we've got. That's called the rig, R-I-G, endoscopic rig. And we're going to place this down the tube. Let's get suction on, please. And we're going to get started. In the meantime, why don't you show the audience the 30 different causes of neck pain. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, welcome back. There's a piece of herniation. It just came out. You guys see that thing float up?
Yes, we did.
All right, so for those of you who have never watched this surgery, you're watching the future of spine surgery right now. And that's bone spur right there that I'm zapping away with the laser. So you're looking at the middle of a tube, okay? I'm gonna come out to the top of the tube. So this is up here in the operating room. Now I'm gonna go down this tube, and we're all the way at the end of it is the tip of the tube is sitting where the herniation is, specifically in the annular tear. The laser fiber is at 12 o'clock. It's 0.5 millimeter, specifically 450 microns, which is about 0.45 millimeter. So it's really small, but it looks big because the endoscope actually makes it look big, right? Hey guys, don't get any ideas. So basically we're zapping away herniation right here. That's his nerve right there. Right there is the nerve. I got to be really careful not to damage the nerve. We're not going to. But you could see how the herniation is pushing on the nerve. And I'm just going to keep removing the herniation right above the nerve. This laser is literally the most precise tool in medicine, in modern surgery. There is no tool more precise. You guys see that white membrane there? That's the dura, or covering of the nerve root. When you guys saw that dark nerve root on the X-ray, the dye was leaking around this and going down the arm. And that's what you were seeing. This is fascinating, folks. Most neurosurgeons do not have this view. I learned how to do ACDFs. I've done 1,000 ACDFs, cervical fusion, using the microscope. And you do not get this kind of view with the microscope, do you, Luis? Luis has been under the microscope with me many times for ACDF, and you can't see this same view. It's much better right now with the endoscope. So just watch that fiber. This is all herniation right here and scar tissue. Any questions from the audience?
At this moment, no current questions.
Got a quiet group this Tuesday, huh?
I know.
All right, so because you guys know everything and there's no questions, let's show the audience how does a herniated disc in the neck cause so much neck pain and arm symptoms from irritating the nerve root, like this herniation is doing.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. And you can see from our video how a herniated disc causes so much neck pain and arm pain. The answer, folks, is simple. It's called inflammation. Basically, when you get a tear in the capsule around in the back of the disc, that tear allows the nuclear material in the center to escape. And that's called a herniation, okay? When that nuclear material that's flipped escapes, it's called a herniation. But the problem is, it doesn't just escape, it really escapes backwards and sits on top of the nerve. And that's when it starts irritating the nerve root. So we're here removing that herniation using a laser. But because we're not taking the disc out to do this, we don't have to fuse the disc, okay? That's the beauty of this surgery. We're actually leaving the patient's disc where it's supposed to be, in their neck. And as a result, we don't have to put a cage, we don't have to put an artificial disc, we don't have to put anything. The disc will heal itself, and that's why we call it the Deuk laser disc repair. Deuk, because it was pioneered here at Deuk Spine Institute. I'm the first in the world to do it. And we use a laser, obviously, and we're repairing the disc. The disc itself will heal. It takes about a year to fully heal. This is all part of the herniation right here. You guys see all this white stuff?
Yes, we do.
That should not be there. So I'm gently zapping it away. I was telling you guys the laser. Oh, look at the herniation. Look at that. See it just
Yes, we
kind of
do.
billow out towards us? There it is. That's a big piece of herniation. All right? I'm going to go grab it because it's stuck there. And people say, why do you need the laser? You need the laser to release the herniations. They're scarred in. Doctors don't understand this disease at all. They literally, the tools that I was trained to use at the very best neurosurgery training program in the world at the time, the University of Florida, those tools are scrapers. They scrape the disc out. You're taking the entire disc out of the person's neck, and what you're left with is just a space, a gap. I need the laser on. Well, we don't want to just take the disc out. We want to leave the disc there. And we just want to take the herniation out, the part that's causing problems. So Dr. Sang-Ho Lee, who is a Korean neurosurgeon, pioneered the endoscopic technique. He worked with a company in Germany called Wolf, Richard Wolf, and they basically built the first cervical endoscope together, and that's what I bought. I bought their creation. I bought a lot of them. It was about 20 years ago. And that's what we're using. We're using a 20-year-old scope, and that's still the most advanced scope in the world right now. People ask me, why don't you buy the newer scopes? And here's what I say. Why would I change what works? We have 0 complications, and we have the best results in the world. Nobody has better results, not even with newer scopes. So why would I change the scope, right? If you have a recipe that works, why change it? Did Coke change their recipe in 200 years? Coca-Cola? No. They're still making Coca-Cola the same way they made it 200 years. All right, any questions?
We have a comment and a question. This comment is coming from Charlie on YouTube,
Hi, Charlie. Welcome back.
saying, funny, you've been making that comment about this being the future. Now, others are starting to admit, and new surgeons / fellows are finally learning endoscopic approaches. You're prophetic.
Well, thank you, Charlie. I appreciate it. I tell my kids, if you look far enough ahead, you'll see the future. And it's not too hard to see that this treatment, this specific treatment, is the future. It has 0 complications. It is 100% successful at getting rid of disc symptoms, disc herniation symptoms. And the recovery is literally, 1 or 2 hours. Why would you, there's nothing, no surgery other than this is as good. The results are not as good for any other surgery. So ACDF is a 50-50 chance of working to relieve symptoms. 50-50. This is 100%. And then ACDF, you're going to be taking narcotic painkillers for weeks or months afterwards because you're in so much pain. By the way, do you guys know what causes pain after invasive spine surgery? You guessed it, inflammation. So why is there so much pain after invasive spine surgery? The answer is because there's so much inflammation. Well, why is there so much inflammation? You should be asking yourself after invasive spine surgery, but not this spine surgery. By the way, that's a bone spur right there. For those of you wondering, can the laser remove bone spur? Yep, just did. These lasers cut metal, steel, easily, so of course they can remove a bone spur. But what I was getting at is this surgery doesn't require narcotics afterwards. You don't take any painkillers. You literally take a Tylenol and you're done. Tylenol. Everybody else is taking Percocets and oxycodones and hydromorphone dilaudid. So this is a much safer surgery, not just during the surgery, but even afterwards. All right, this is probably the last of the herniation. And we've shown the audience how the Deuk laser disc repair works, right, Henry?
We have not yet.
Let's do that. Let's show them, and then we'll take some more questions. We'll be done in 5 minutes with this surgery.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. So you can see from our video that we use a laser to clean the tear in the back of the disc where the herniation comes out of. And by doing that, it allows this tear to heal itself naturally. So the Deuk laser disc repair is really about helping your body heal itself naturally. We're just about done. I'm going to look around again to the right side because that's where most of his arm symptoms were. I got to float out a few pieces of herniation. Why don't we take some questions?
First question coming from Amanda on YouTube.
Amanda, welcome.
asking, in someone who has degenerative disc disease in
Yes.
L5 to S1, how common is it to occur in other areas of the spine?
So, Amanda, great question. Degenerative disc disease is most commonly occurring in the lumbar spine, which is what L4-5 is. L4-5 is the most common level, but the second most common is L5-S1. I just want to show you guys, that's a bone spur right there, right above the nerve, but it's not pushing on the nerve. And look at this pink area right here. You guys see the pink? That's inflammation. It should be white, not pink. So that's the source of his pain. That nerve root right there has been getting inflamed for years. And you can tell this injury is really old. It's not new. He's got a lot of calcification, a lot of scar tissue. This has probably been here for about, probably 20 years, if I had to guess, 20 years plus. All right, we're just about done. You can see the nerve root is decompressed. That's the nerve root right there, okay? I'm bumping it with the laser, but I'm not going to zap it with the laser. And this area still has some inflammation. There's another piece of herniation right there. That's what herniations look like, by the way. They're kind of feathery looking, like crab meat. That's why everybody says crab meat. Any other questions?
Yes, we have 2 more questions. For next one coming from Frank on YouTube,
Frank on YouTube, sure. Thanks for joining us.
saying, Dr. Deuk, I had a C3, C4, ACDF fusion.
Yeah.
Can you still do laser on C4-5
Yes.
and facet joint rhizotomy on someone who has had ACDF already?
100% yes, Frank, we can. If you've had spine surgery already and you're still suffering with problems, we can still fix you at Deuk Spine. We can do your additional treatments with our laser and our plasma. No problem. I just need to do an MRI review with you and make sure that your metal plate does not cover your disc. Look at that piece of herniation right there. It's so big it doesn't even want to come out by itself, so I got to go grab it. All right? Sorry, Berndes, I think it's taking a little bit longer than I expected, but this disc injury was worse than I expected it to be. Yes, we can help you. Look at the herniation, by the way. I want to show you guys. Bring the ruler. Can you see this, Henry? I just fished that herniation out, okay?
Yes, we can. Yep.
So here is the ruler. You guys see this?
Yes, we can.
All right, so there it is, right there. It's kind of whitish looking, and it's about 7 or 8 millimeters long and about 3 millimeters wide. But that's what they look like, folks. And the herniation isn't one, it's always about 20 or 30 pieces. So remember, herniations keep happening throughout your life, and that's why you get these, pain that comes. Ariana, you want to come a little closer? Come here. Come here, stand right here. But just don't touch the blue. You see? You okay? Not lightheaded, are you? The first surgery I ever watched live, folks, was at USC in Los Angeles, med school. It was the 2 days before I started medical school at University of Southern California. My roommate, Dr. Aaron Cohen Gadol, he actually graduated from UC San Diego, just like I did, and he went to USC med school, and we were roommates. I didn't even know who he was, so I went to my room at the nurses' dorm to check in like 4 days before school started, and Aaron was already there and introduced himself. We both went to UCSD, and he said, you want to go watch surgery at USC? And I said, how can we do that? We haven't even started med school yet. We don't start till Monday. And he said, oh, come with me. So we literally just walked from the nurses' dorm across the street to the hospital, walked in the back door. This was in 93. So there was no security, and anybody could walk in a hospital, and especially County Hospital, LA. And we just went straight upstairs, and there was an orthopedic surgery happening at like 9 o'clock at night. Some patient with a car accident, and the shoulder was like ripped off. And so that we went in and started watching. We asked the surgeons, can we come in? We're med students. They said, yeah, come on in and watch. Within 5 minutes, I started getting lightheaded, hyperventilating, and then I basically passed out. I had to go out and lay down in the hallway outside the operating room. And my friend Aaron was laughing his head off at me, saying, you want to be an orthopedic surgeon? Are you kidding me? How are you going to be an orthopedic surgeon? You can't even stand the sight of blood. and surgery. Well, needless to say, I obviously became a surgeon. It didn't bother me so much after that episode. Thank God I did, because we've revolutionized the entire neurosurgical field, spine surgery field. And imagine if I had given up at that moment and didn't complete my training. World would be a different place. All right, just about done. I got about 30 seconds left. We're looking way out the foramen. I don't see any more herniation. There's a little grungy stuff here, but the nerve root is totally decompressed. It looks like there's still a few pieces of herniation kind of towards the middle, which I got to pull out, but we're pretty close to being done. I'm going to go grab these pieces. Any questions?
Yes, we have a couple more questions. Next one coming from Faisal on Facebook.
Oh, Faisal. When are you going to make a commitment, Faisal? When? My God.
Faisal asked, can a pinched nerve cause your neck from to stop moving, or would that indicate something more serious like a fracture?
Yeah, so your neck will stop moving from pain if you have facet joint pain. Almost done, Dr. Burden. There's a few of these pieces of herniation left. Faisal, pinched nerve does not stop your head from turning. It's facet pain that does. Faisal, you're disappointing me. You've been watching these surgeries for 6 months now. You should know facet pain is the cause of rotational discomfort. Henry, let's show the video on cervical facet joint pain, how it causes pain and how we fix it. Welcome back. You can see from our video animation that facet joints, which are located in the back of the neck, you have a right and a left facet joint for every disc. That's what causes pain when you turn your neck side to side, not disc problems. Okay, we're done. You can see how small the incision is. This is a 1 inch. This incision is only 7 millimeters. So I'm going to take this tube out, and we're pretty much done with surgery. I'll hold pressure for just a minute, because there are some veins. This guy's a bodybuilder along with a law enforcement job, so he's got thick veins in his neck, and sometimes you might cut a vein, and that's fine. It stops bleeding on its own. What we worry about is arterial bleeding. Arterial bleeding doesn't stop on its own usually, but vein bleeding does. Wow, you really got him down. Maybe I shouldn't be massaging his carotid.
I just gave him a second.
All right.
We have a couple more questions.
He's a healthy, fit guy. He's just,
He's going to be okay, right? All right. Yeah, go ahead, Henry.
These next two are coming from Ramazan on YouTube.
Before we go, let me show you guys the incision. Look how tiny that is. Okay, it looks like this guy got attacked by a one-toothed vampire, right? At Deuk Spine. All right, we'll take any other questions you guys have.
Next two questions from Ramazan asking, first being, is endoscopic cervical foraminotomy exactly the same as the procedure your Deuk laser disc repair, or is it just similar?
No, endoscopic foraminotomy is a horrible surgery. They drill your bones and ligaments out from the back of your neck, and it's not even the right way to go to fix the problem with the disc. It is not the same surgery. It's completely different. Next.
From Ramazan once more, asking, what is the difference of neck surgery, or what is different neck surgery, some of from back, but your one surgery from the front? Are you doing any surgery front?
Yeah, I'm operating from the front right now. We're going from the front through the disc to the back of the disc, and we're using a laser to remove the herniation from the back of the disc and clean the tear that it came out of.
Next, I'm sorry.
Go ahead.
Next from Charlie on YouTube asking, have your videos about the insurance industry began to make the industry rethink their posture on covering your procedures? If not, what will it take?
Yeah, so great question. Somebody's asking, Dr. Deuk, the insurance companies, some of them don't cover your procedure, which is true, and others do cover the procedure, but it depends on your insurance policy and your insurance coverage. And he's asking, are your videos changing the way insurance companies think? They will eventually, but insurance companies don't want to pay for your surgery. They don't want to pay for any surgery or any treatment. Every time they pay for a surgery or treatment, they're losing money. So they want to not pay, so they look for any excuse not to pay, and there is no law that says they have to pay. The only law that exists says they have to pay according to their contract they have with you. Well, guess what? They write the contract. So what they write in their contract is they're not going to pay for anything they don't want to pay for. But you people don't understand that because you're not lawyers. So you guys sign the contracts and you think you have great benefits. Then when you need actual surgery to fix your medical problem, you can't get it because the insurance won't pay for it. That's the trick that they're playing on you.
And then lastly, coming from Stuart on Facebook, asking, so Doc, I have a question. Are they in twilight for sedation, or are they in full general anesthesia? Which are you using? Just curious. I've got to get hernia surgery this Tuesday, laparoscopic with mesh. Best guy in Sarasota, Florida. He's done over 15,000 of these.
Yeah, so I assume what you're talking about is a hernia surgery for your groin or your belly, not your disc, right? Because if you're going to have spine surgery, you should come to Deuk Spine. But as far as hernia surgery for your groin, I think you're right. You want to go with a surgeon who does a lot of volume and is very confident doing the procedure. I don't know if I answered the question completely there. Huh? Oh, what sedative we're using?
Yeah, exactly.
This patient's under general anesthesia. He has a tube down. He's on a ventilator. He's completely out. But our lumbar cases are done with twilight.
And that is it for questions.
All right, let's run a nice patient testimonial, and then we'll see you guys in about 45 minutes for our next surgery. Thank you. And good morning, I'm Dr. Deuk Majan at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, do you have a herniated disc? I can fix you. And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, you're done already? The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option, because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.